Good morning. This is the report of the clinician survey on management of patients presenting with severe febrile illness. MSF is implementing a febrile illness diagnostic program, and the goal of this program is to improve the capacity of MSF to manage patients that fit the definition of severe febrile illness without known source. The survey collects information from MSF clinicians about current diagnostics tools and their diagnostic needs to improve patient outcomes. The information will be complemented with other studies such as chart review, algorithm development, and landscape of existing diagnostic tools. The definition of severe febrile illness without known source is patient with fever, independent of duration, and without evidence of localized infection by history, physical examination, and the laboratory tests standardized by the MSF working group, and include the identification of severity. It's not a standard definition, but we include danger signs or risk factors to define severity. The methodology is a survey sent to MSF field clinicians that include doctors, clinical officers that are currently working or worked in the field in the past 2 years. The survey had 9 questions and was sent to 595 clinicians with the support of the medical and human resource departments. Results: 191 clinicians, 32.1% from 36 countries answered the survey. 95% were medical doctors, and on average took 7 minutes to answer the survey. Looking at the specializations, 95 were reported not specialization. A lot of them report to be general practitioners. Then you have pediatrician, 24, emergency medicine, 16, and obstetrician, 11, internal medicine, 8, surgery, 7. Months in the field, the most common is 1 to 2 years, and you have clinicians with only less than 6 months, that is around 70%, and clinicians with more than 5 years, that is less than 10%. In which countries they worked or they are working, like you see in the list, South Sudan is one of the first, 29 clinicians, Nigeria, Bangladesh, Yemen, Iraq, Central African Republic. That is related with the number of expatriates and doctors that we have in these countries too. What type of clinical decision support tools they use? They use algorithms or clinical decision support that from MSF, that is reported by 39% of the clinicians. Other type of tools that are not from MSF, 26%, and most of them are paper-based. Only 70% were based on computer or tablets. What type of tools? So one is MSF guidelines on paper and online, WHO guidelines, NICE from the UK guidelines, fever of unknown origin guidelines, guidelines developed by a specific hospital or projects, and the electronic tool that were mentioned for 4 different clinicians was up to date. It's an electronic tool that gives information to the clinician about the diseases and help to take decisions. 2 clinicians mentioned that there is not a real possibility to have a tool that helps in management of severe febrile illness patients. 67.2% of the clinicians treat patients that fit the definition of severe febrile illness without known source, like I mentioned before. Among them, if we look at the specializations, 72% of the clinicians that are general practitioners, has no specific specialization, confirm that they see and they treat patients with severe febrile illness without known source. 92% of the pediatricians and 69% of the emergency medicine and 83% of the infectious disease specialists. Looking at the countries, countries like South Sudan report 76% of the clinicians report to have treated patients with severe febrile illness without known source, and in Bangladesh was 83%, and in Nigeria was 70%. What type of diagnostics tools they use? The first is malaria, rapid diagnostic test. Then malaria microscope is other very common. HIV test, CBC are the four more used diagnostic in the field. But you can see that other diagnostics include blood culture is used in 30% of, was used by 30% of the clinicians. What is the management? The most common management is empirical broad spectrum antibiotic treatment, and that is reported by 85.4% of the clinicians. Some of them combine with antimalarials or give first antimalarial and then use antibiotics. The type of broad spectrum antibiotics they use is ceftriaxone. 61% of the respondents mentioned ceftriaxone, 20% ampicillin, gentamicin as a combination, and 30% mentioned to combine metronidazole IV with the other two. Other clinicians mentioned that depends on age, depends on the location of the suspicion, depends on the context, the decision of what of these antibiotics to use, plus depends on what they have in the field. The outcomes. Good outcome is reported in 33.6% of the patients, according to the clinicians, and that is very low good outcome for severe febrile illness without known source. The diagnosis tools that they need. So they mention better local epidemiological data. Second, update MSF clinical guidelines to use or to have access to more specific tests or multiple tests, and a test that differentiates between bacterial and non-bacterial infections. The conclusions are 191 clinicians, 32.1% from 36 countries respond to the survey. Most of these patients are treated by general practitioners in MSF project. MSF clinicians are using guidelines and tools to guide their diagnosis and patient treatment. MSF clinicians are regularly using some basic laboratory tools such as malaria, urinalysis tests, HIV, and CBC. 85% of the clinicians use broad spectrum antibiotic treatment, and the needs are better local epidemiological data, outdated MSF clinical guidelines, microbiology tests, tests for specific or multiple pathogens, diagnostic tools that differentiate between bacterial and no bacterial infection. Thank you very much.